Dr. Kara Nelson is a professor in civil and environmental engineering and also an associate dean for equity and inclusion at the College of Engineering at UC Berkeley. Oh, good, Kara. Professor Nelson's research program addresses innovative strategies to improve the sustainability of the urban water infrastructure, and that includes technologies for potable and non-potable water reuse, nutrient recovery, decentralized systems, intermittent water supply, household water treatment, and affordable sanitation. A Renaissance woman. And lately, she has been involved, and we'll be talking about her research focus on the control of waterborne pathogens and evaluation of wastewater in terms of COVID. And also a couple other points. Professor Nelson is very active and leads the engineering thrust for Renew It, which is a very good institution we'll be hearing about more tomorrow, along with the Bay Area One Water Network, and recently served on an expert panel advising the state of California on the feasibility of direct potable reuse. I hope she was for it. Dr. Nelson was awarded the Presidential Early Career Award for Scientists and Engineers at the White House in 2004. And this is the nation's highest honor for scientists in the early stages of their career. But we do share her with other countries besides ours, and she's been active with research in India, Bangladesh, Kenya, and Panama. Well, with that, Professor Nelson, take it away.
Thank you so much, Dennis. That was, you're not supposed to read all that stuff.
I know, but I couldn't cut anything.
Thank you for that very thorough introduction. That's from like my bio on the website. I gotta be careful when I refer to people to that. So thank you so much for this invitation. It is truly an honor to be kicking off WaterPalooza. And I will be talking about wastewater. And I think it's entirely appropriate that we kick off WaterPalooza and the 20th anniversary of Sustainable Silicon Valley talking about wastewater, because it is so essential to sustainability and sustainable water infrastructure. And it's something that people usually don't like to talk and think about, but these are unusual times for so many reasons. And surprisingly, there is more interest in wastewater right now than I have ever experienced in my lifetime. And that is because wastewater turns out to be a fantastic resource for tracking COVID infections in our populations. So there has been, since the beginning of the pandemic, a massive mobilization around the Bay Area, around the whole country and the world about how developing the techniques and then the infrastructure that we need to take advantage of this new use of wastewater to fight this global pandemic. So I'm going to launch into telling you what we have been working on in my group at UC Berkeley, but I'm going to put this in the context of this larger global effort that's going on. So as I launch I want to start by acknowledging the fantastic team of researchers that I have been fortunate to lead here at UC Berkeley. We come from many different research groups and disciplines, and there was just a tremendous interest at the beginning of the pandemic for scientists and engineers to contribute their skills to pandemic response. And so we mobilized and came together to take on this project that I'm going to share more with you about. So first of all, what is wastewater-based epidemiology? I'm going to explain this in the context of COVID, but of course this can be applied to other substances that are in our wastewater as well. So specific to COVID, the SARS-CoV-2 virus that causes the infection and infects our respiratory tract. Unfortunately, the cells that the virus binds to in our respiratory tract, the receptors on those cells also exist on the epithelial cells in our intestinal tract. So the SARS-CoV-2 virus infects our intestines as well. The only good side of that is that means infected individuals excrete the virus. And so this gives us a new approach for trying to track infections. So the virus ends up in our wastewater, and we can then monitor anywhere downstream of where waste enters the system to get a measure of infections upstream of that point. So we can monitor at individual buildings, at the neighborhood scale, or at wastewater treatment plants. And this has some potential advantages in over other types of data, and when combined with other types of data, can give us an even better sense of what's going on with COVID infections in our communities. So one beautiful thing about wastewater is that it is an inherently pooled sample. So by collecting a single sample, we can get information on hundreds or thousands or even millions of people, depending on where we're sampling and what the size of that sewer shed is. This information can be less biased than the individual testing data that is so relied upon, because not everyone gets tested. So we get information on asymptomatic individuals in the wastewater and on individuals that, for whatever reason, lack of access, et cetera, cannot get tested or are not getting tested. And if you just look at the graphic on the right, the shades indicate the testing per capita in the city of San Francisco, and you can see that it varies widely. So that information provides a biased view of what the prevalence is in those different census tracts. So wastewater can help to bridge that gap. And there's also potential that it can provide an earlier signal, because individuals actually start shedding the virus in their feces before they show symptoms, even if they do become symptomatic. So there's a potential to pick up that information earlier than someone would go out and seek to get an individual diagnostic test. So all of those reasons have led to this widespread mobilization of developing and applying this tool. And just to give you an example of how this information might be used for decision making, on the left-hand side, I'm representing the different scales at which we might collect samples. And then on the right-hand side, different ways that this information might feed into public health response. So if we sample at individual buildings like dormitories, skilled nursing facilities, or prisons, that is a much more efficient way to sample that population, because it's simply not feasible to test every single individual every day in these residential facilities. So based on the wastewater information, as long as the wastewater remains negative and the sensitivity of the method is low, that is reassuring that there are no infections in that residence. But as soon as we get a positive, then the response can be go in and do individual testing to track down the infected individual or individuals and do contact tracing and isolation. And then at the neighborhood scale, this information can be useful for identifying hotspots in a community, for getting information on communities where there's a very low testing rate, et cetera. And so to help health departments better direct their resources to where they can be most effective for preventing the spread of infections. And then finally, at the largest scale, like at the scale of the wastewater treatment plant or even entire regions, this information can be very helpful for providing an additional input to making decisions about whether it's appropriate to be relaxing shelter-in-place restrictions or if they need to be further strengthened, which seems to be the situation we're in right now. But long-term or longer term, we hope this pandemic is coming to an end soon. And as vaccines start to roll out, the wastewater sampling could be a very efficient way to get a snapshot on large numbers of people at one time to confirm that prevalence is remaining low, which is what we'll need to fully reopen again. So with that, I'm going to now launch into some of the details. So at the beginning of the project, we realized that we couldn't follow the typical scientific research approach, which is do all your research first and then move on to implementation. So we were worried that if we followed that approach, we might miss the pandemic and this tool would never get into implementation to actually be useful on the right time scale. So we've been working in parallel to develop both the research tools and the implementation infrastructure to put this tool into practice here in the Bay Area through our regional monitoring program that we call COVID Web, and I will tell you a little bit more in a moment. So I'm going to walk you first through just some of the research highlights. So one of the first things that we worked on was just developing a method to measure this virus in wastewater. Of course, there were no methods because this virus only evolved recently, but there are many other methods for measuring viruses in wastewater. But we recognize that many of them had limitations because they focus on concentrating the virus itself. And one thing that's unique about SARS-CoV-2 is that it's pretty wimpy in wastewater. It hasn't evolved to survive for a long time outside of the human host. And so we hypothesize that it actually lyses as soon as it enters the wastewater system. And so we wanted to develop a method that could capture the RNA, which is the genetic code of the virus, whether it exists inside of intact viruses or not. And so the method that we developed with collaboration with our colleagues in molecular biology, we call it the 4S method, sewage, salt, silica, and SARS-CoV-2. And it relies on very common reagents like table salt to lyse the viruses and release their RNA, which we then pass the sample with the lysed virus through silica columns, which are very inexpensive and widely available to concentrate the RNA, and then we quantify the quantity with a polymerase chain reaction. So this is a nice innovation that we are seeing other labs start to adopt because it's low cost, doesn't rely on reagents that are difficult to acquire or proprietary kits, and is pretty quick. And as I'll show on my next slide, has a very high recovery and that translates into a low detection limit. So this graph just shows the gene copies per liter, and you can see that the red and the green box whisker plots indicate that the concentrations that we measured in this sample were much higher than in an alternate method using ultrafiltration, which is a more conventional approach. We measured 6-fold higher concentrations. So this method has a lower detection limit, which is really useful for monitoring areas with low prevalence, and including residential facilities. It increases the likelihood that we will detect a single case in a population of several thousand people. And there's evidence that this method is effective at that level. The other research contribution that we took on was the ability to detect different strains of the virus in wastewater samples. So early in the epidemic, there was effort put into sequencing the clinical samples that are being collected around the world, because this information, so the RNA of the virus mutates over time at a slow rate. And so by being able to distinguish different strains of the SARS-CoV-2 virus, we can get information on how the virus spreads. When new strains appear in a community, that means that they were brought there from somewhere else. So we can actually do spatial analysis on how different strains are spreading around the world. But there's also a limitation to relying on clinical samples because they cannot all be sequenced. So we set out to develop a method to sequence the strains of the viruses that are in wastewater. These are also with collaborators on campus that specialize in sequencing and bioinformatic techniques. So we developed a technique. I'm going to show you now some of the results. In this graphic here, each horizontal line represents a patient sample that was sequenced in California, or from a California patient. As we start moving through the first phase of the pandemic. The upper part of the graph shows similar information, but for patients outside of California. So those are shown in green. And now I'm laying on top of that, the red dots are the strains that we detected in wastewater samples. And so 2 key takeaway points. One, we were able to pick up the same strains that are being measured in California patients, but we also detected some strains from elsewhere in the US from patients elsewhere in the US that had not yet been detected in California patients. So that means, again, that we are getting an earlier signal in wastewater on strains that are being brought into California. And it's and also in using a very efficient method, all we have to do is sample the wastewater instead of hundreds or thousands of patient samples. So now moving on to how we have been putting these new tools into practice. So we have put into place a sampling strategy, so sampling at these different scales around the Bay Area. And then the testing is what happens back in our laboratory. And then through our data analysis, we gain the ability to do things like analyze trends in prevalence over time, or do geospatial analysis, where we can compare the prevalence of COVID-19 in different communities around the Bay. So the way that we've operationalized this for our region is through launching this project called COVID Web, Wastewater Epidemiology for the Bay Area. And any wastewater agency is invited to participate in this. And we collaborate directly with the public health representatives from 8 of our Bay Area counties. And this has been, or I would say this is the part that we're working on the most now, is how do we actually take this information that we are gathering from our wastewater samples with the close partnership of over 20 wastewater agencies in the Bay, who are putting in a tremendous amount of effort to collect these samples and give them to our laboratory. How do we actually translate this into useful information for our decision makers and our public health departments? And throughout all of this, so our focus has been on our Bay Area right here, but we are working hard to coordinate our efforts with those that are happening, other efforts that are happening at the regional level and state level and federal level. If you don't work with wastewater, here's what it looks like to collect a composite sample, because what we need are representative samples for a whole 24-hour period. So these are collected through a composite auto sampler, and that's quite a bit of effort. And if we're sampling at the community level or at a building level, that requires an access point. And so that is something important that needs to be considered. Here's what our laboratory looks like. So in order to have enough capacity to test all those samples, our regular research lab was not big enough, especially with social distancing requirements during quarantine. So we actually built out a whole new laboratory on the UC Berkeley campus with all the necessary biosafety features, et cetera, and hired a whole new staff of people to run it and process these samples, where we're processing currently about 200 samples a week. And that we may be increasing that further with some improvements in automation. So before I wrap up, I want to share just a few highlights of results for you so you can get a sense of how this information can be useful. So here's an example from our own campus here at UC Berkeley. There's a large apartment complex with 2,700 residents where we are monitoring. And what we hope to see is that the concentration of the SARS-CoV-2 virus in gene copies per liter is below our detection limit. When we see a positive, as indicated here on the graph, that indicates there's one or more infected residents. And so this first peak, this was our first sort of proof of concept, where we showed that we were able to detect in the wastewater the signal from what turned out to be 2 infected individuals in this population of 2,700 residents. So that was an encouraging proof of concept, and now we have implemented this approach at a number of residential facilities both on campus and around the Bay Area. And then the next results I'm going to show you correspond to this map on the right from the East Bay Mud Service area, which can be divided into 3 different regions based on the 3 main interceptors that arrive at the treatment plant. Oops. And oh geez, going in the wrong direction here. On the left graph, we see the prevalence of infections based on case data, so number of new cases per person per day for these 3 different sewer sheds. And on the right, you can see the concentrations of the virus that we've measured in the wastewater. And the point is that they roughly correspond. So we're able to distinguish regions of higher and lower prevalence using the wastewater. So with that, I want to come back to my original point, which is that there is more interest in wastewater now than ever. So we are developing all these very useful tools, applying them to the pandemic. This approach of wastewater-based epidemiology is something that we're going to be able to continue to apply after we beat this pandemic to other uses. And we also have this great opportunity to take advantage of all this interest in wastewater to continue our work of educating people about thinking about wastewater as a resource and not just something to flush down the toilet. So with that, I want to thank you for your time.